Imagine a hormone that makes your skin look younger, increases your energy, your muscle mass, improves your libido, your potency. Isn't that wonderful? Well, it exists. But unfortunately, few doctors use it, and many, when they do, use it incorrectly. I'm talking about DHEA. Hello, family. Welcome to another video here on our channel. Dehydroepiandrosterone, commonly known as DHEA, is the basis for the synthesis of several hormones. Among them, testosterone. For this reason, many people use DHEA to increase muscle mass, to improve libido and potency. And since it's a hormone that starts to decline after the age of 30, its replacement brings enormous benefits. For your health, for your energy, and it also prolongs your youth. But hold on. It's not just about taking it randomly. For DHEA to be effective, it has to be lacking in your body. Otherwise, it can cause more problems than benefits. When should you use DHEA? What are the ideal levels? I'll tell you right now. That range that appears on your test is far from ideal. What are the doses? What precautions should you take? I'm going to break down all the information you need to know about DHEA in this video. So, go ahead and leave a like, give it a thumbs up. Don't forget to share it in your groups and let me know. Are you already over 30 years old? Did you know about this hormone? Have you ever measured your levels? Tell me in the comments below. My friends, don't forget to check out my website. On my website, you'll find all the supplements I use that I recommend and that you guys are always asking me about on my social media. What do you mean? Which are the best options for vitamin D with K2 magnesium and omega-3? Which is the best testosterone production booster? It's all there on my website. The dosages, how to use them, my courses are there too. My other social networks are www.dedidado.org, upassetudojunto.com.br. Did you know that in the United States, DHEA is sold on supermarket shelves? That's right, there it's considered a supplement. Anyone can buy it. But here in Brazil, it's not quite like that. You need a medical prescription, a doctor's note. Then you'll have your medication made at a compounding pharmacy with the dose you need. Why is DHEA so important, and why does proper supplementation improve your health and energy so much? Well, first of all, it's a hormone that tends to decrease after the age of 30. You have a progressive drop in the production of this hormone. And then all the hormones that depend on DHEA also decrease, including testosterone. And then you have the symptoms. You have more difficulty with cognition. Your memory starts to fail. You lose muscle mass. You lose fluids. Your energy decreases. That's why it's so important for you to undergo replacement therapy. But replacement therapy has to be done the right way, and for that, you need to know what the proper levels of DHEA are. I'll talk about it at the end of this video. And as I said at the beginning, it's far from being within that range listed on your test results. Let's go. What is DHEA? DHEA is a hormone that acts as the conductor for other important hormones. It is produced from cholesterol. That's why people who take medication to lower cholesterol have low levels of DHEA. Why? Because this hormone is produced from cholesterol. Cholesterol produces a hormone known as pregnenolone. This hormone is also found in the United States as a supplement. It is widely used to improve intellectual capacity, to improve memory, for those with adrenal fatigue or experiencing burnout. Pregnenolone is a hormone that can be converted into progesterone, which is a fundamental hormone for women, for example, who have entered menopause, right? If you've entered menopause, you stop producing progesterone. It's very important to undergo hormone replacement, but that's a topic for another video, right? Cortisol is also produced from pregnenolone. That's why stressed people have low levels of DHEA. Because DHEA is also produced from pregnenolone. So if you're producing a lot of cortisol, if you're stressed, this pregnenolone is being directed toward cortisol production. and there's not enough pregnenolone left to produce DHEA. That's why people who are stressed, who sleep poorly, have low levels of DHEA. I'll talk about the proper levels at the end, okay? All right? Why is DHEA so important? Because it's from DHEA that testosterone is produced. And testosterone has all the beneficial effects. Of course, as long as it's at the proper level that we know of. Increased energy, increased muscle mass, makes it easier to burn fat, improves libido, improves sexual performance. It protects our cardiovascular system. That's right. Low testosterone levels, you're more likely to have cardiovascular problems. It improves your cognition, your reasoning, all good things, right? But if Marcelo, so should I just start taking DHEA? Because then I'll produce more testosterone and I'll be great. It's not quite like that, okay? It's not quite like that. Why? Because if you produce too much testosterone, it can actually go 2 or 3 different ways. It can have the beneficial effect of testosterone, right? Which acts on the receptor and will bring all these benefits. But excess testosterone can be converted into estradiol through an enzyme known as aromatase. Estradiol is a feminizing hormone. That's why people who overuse testosterone end up with those little breasts, right? Gynecomastia. That's when a person has too much testosterone. That testosterone is being aromatized into estradiol, and the excess estradiol can cause several problems. Because it can also be converted into estrone. It makes you gain weight. Estrone can increase the risk of cancer, prostate cancer in men and breast cancer in women. So do you see? It's not about just taking hormones any way you want. If you have excess DHEA, a certain hormone, it will end up converting into something you don't want. And excess testosterone can also be converted by an enzyme known as 5-alpha reductase into DHT. DHT brings other symptoms such as hair loss, deepening of the voice in women, enlargement of the clitoris in women, and oily skin with excessive acne production. So, it's important to have optimal levels of both DHEA and testosterone. And how do you know that, Moacir? Well, through a very simple test where you measure SDEA, which is the form of DHEA, DHEA sulfate, which is the form that remains more stable in our body. The SDEA levels need to be, write this down, between 250 and 300 micrograms per deciliter. And you'll see in your test results that above 25, for example, for those over 59 years old, it says there above 25 is considered normal. It's not normal, my friends. It's low. Of course, a person who doesn't do the replacement, someone who's 59 or 65 years old, will have very low levels of DHEA. But that's why this person aged. Why? Because it's the hormone that gives you bone mass, it's the hormone that gives you muscle mass, it's the hormone that gives you good memory, it's the hormone that gives you libido, desire, potency. So people have the wrong idea. They think they age and then produce less hormone. No. You age because you had little hormone. Hormone is a rejuvenating factor. Of course, it should be done by a professional who knows what they're doing and in the right way. So you need to maintain these DHEA levels regardless of your age. So, if you're 60 or 65, it has to be between 250 and 300. And DHEA is much safer to use than using testosterone directly. Because DHEA will only produce testosterone as needed. So, it's a treatment that can bring excellent results. And it's safe. And what is the dose, Moacir, that is used? Well, the dose depends a lot, my friends, on the amount of DHEA you have in your blood. So, if it's very low, you need a higher dose. If it's close to normal, you need a lower dose. That's why therapeutic doses vary around 5 to 100 milligrams. But I repeat, the results are extraordinary. Of course, the doctor has to know. He will give the dose, measure the DHT, see if it's not going up, and then make adjustments, then go back. After 30 days, he will measure estrone to see if it's not increasing, measure estradiol to see if it's not rising, and monitor the patient. And this is done on a case-by-case basis. You can't talk about a standard approach. Do you have these levels or are you going to take this dose? No, you have to evaluate because there are patients who, for example, are more overweight. Those who are more overweight have more aromatase. So there's a greater tendency to aromatize testosterone. So you have to adjust the dose. So it can bring a lot of benefits, but it needs to be done correctly. Otherwise, it won't bring benefits and can even cause harm. My friends, same website as always, okay? www.DHEA, Moacir, tudo junto.com.br. On my website, you can find all the supplements I use, the ones I recommend. My courses are there, and my other social media are there too. Make sure to check it out. And if you're not subscribed to the channel, it doesn't cost anything, my friends. It's free. Just click on subscribe. Don't forget to hit the bell, and don't forget to select all. I hope you enjoyed this video. I tried to summarize it. It's a very complex topic, and I tried to present it in a concise, easy to understand way. Did you guys understand? If so, type in the comments, Moacir, I got it. If not, you can say in the comments, Moacir, I didn't get any of it. You'll have to make another video to explain it more clearly. I'll do it. All right, my friends. Big hug to you all and see you next time. Until then, everyone, bye.